Welcome to yet another interesting episode of the Health Package Field Program Community Health. With me, your regular host, Hasia Ali. Today in the studio, we have Dr. Abdul Fattah Isiak from the Department of Family Medicine, Ahmadu Bello University Teaching Hospital, Shika, Zaria. Dr. Isiak is a member of Association of Resident Doctors, also from the Ahmadu Bello University Teaching Hospital, Shika, Zaria. Dr. Isiak, we say welcome to the program.
Thank you for having me.
You're most welcome. Well, listeners, today Dr. Abdul Fattah Isiak will be talking to us about kidney failure. So, Dr. Abdul Fattah, let's start with what is kidney?
Kidney, it's a paired organ in our body and bean-shaped.
Okay.
Like we have been taught in our biology classes. So it's bean-shaped and it is paired, located around the lumbar area, just by the sides of the body. So that's basically the kidney.
Okay, when you say it's a paired organ located at the lumbar of the body, you mean everybody has more than one kidney?
Yes, everybody has two.
Two.
Except in rare cases where you may have somebody having only one, or the kidney located in abnormal places.
Okay. But most of the time, you're born with two kidneys, two functional kidneys.
Yes, ma'am.
All right, so now let's look at what is kidney failure.
So before we talk about kidney failure, talking about the kidney itself, it's one of the most important organs in the body. Just like somebody talking about the eyes, for instance, we know that the eye, because of its function, so the same thing with the kidney.
Okay.
Because of the work the kidney does in terms of excreting toxins. When our body produces toxins, the kidney helps us to excrete it out of the body through the urine. So when the kidney is not able to perform this function again, we say there is kidney failure. And by the time the kidney fails, usually when people present, it has gotten to a stage that it's unlikely to be reversible. What you just do at that stage is to manage the condition, slow down the progression of that kidney failure before we can say kidney failure. When you have organs that are paired in the body, usually from the wisdom of our creator, it's usually very difficult to lose the two at a time. If you lose one will start compensating for the other one. So by the time you now have the two packing up,
and at that times that the two packed up,
when one is failing, the other compensates for it. And usually you will not know, because if somebody has only one kidney, it suffices for the person if he maintains it. That's why you see people donating their kidney, because one is enough. But when you now even have two, and the one is failing, the other is compensating to the extent that the other two is also failing. You understand? By the time the same sign and symptoms start coming up, at that stage, it's very unlikely for it to be reversible, for the person to survive. That's why it's a very notorious condition, so to say.
The word notorious just made me laugh. To me, that's like a criminal in the human body.
So,
all right, when you were talking, you talked about having difficulty in urine, and this could lead to kidney failure. So does it mean anytime one has difficulty in urine or unable to urinate, it means there's a problem with the kidney?
When you say somebody is not able to urinate, there are many causes.
Okay. So there are many causes aside this. Okay, now.
And it on its own can be a sign of the a cause of the kidney failure. It's a sign of obstruction. There's an obstruction somewhere. That's why the urine cannot pass. And we know, like we said, the urine contains a lot of toxins, chemicals that the body wants to get rid of. So by the time it's getting blocked, it's not able to pass out of the body, there's obstruction, then there will be backflow, what we call backflow. The urine will be spreading inside the body system and creating more damage.
Okay. So now, let's now talk about the causes of kidney failures. What actually leads to a failure in the kidney?
There are many causes. There are many conditions that can cause the kidney to fail. The commonest ones in our environment, the top causes, we have the hypertension and we have diabetes. See, these two conditions, they on their own, they are also disease conditions You understand that there are different topics on their own, that people really need to take care of. If somebody has only diabetes, it's a whole lot of this thing that you need to take care of, so that it will not create complications in the system. The same thing with hypertension. And if somebody now has the two together, it's like a double insult. So some of the organs that bear the brunt of these of the complications of these conditions, one of them is the kidney. When we talk of end organ damage, when these conditions have been long-standing in the body, or they have been poorly managed, both hypertension and diabetes, they tend to affect some organs, including the eyes, the heart itself, the kidney, you understand? So we call them end organ damage. So one of them is the kidney. When they affect the kidney to a certain extent, then it can cause kidney failure. So apart from diabetes and hypertension, we have other causes too. There are two types of kidney failure. We have acute and chronic. The acute one is the one that occurs within a short time. Let's say within days.
And must be managed
instantly. And usually they are reversible. That acute kidney failure, you can reverse it. For instance, somebody maybe has an accident and loses a lot of blood. You understand? When there's poor blood flow to the kidneys, it can cause them to fail. Or somebody has acute diarrhea disease, has been having vomiting and diarrhea, has passed a lot of his body fluid. The kidney can also fail.
Wow.
Or somebody is exposed to certain toxins, chemicals that is toxic to the kidney, you understand? Or some drugs. Some people abuse drugs. Some drugs are very toxic to the kidney. So when they are exposed to the kidney is exposed to them, it can cause them to fail in an acute way within days. Usually when you remove those insults, the person that is having diarrhea, you correct it, you hydrate the person, you give him fluid, or the person that has lost blood, you give him blood, then the kidney will come back to normal. That's acute kidney failure. On the other hand, chronic kidney failure develops over years, and the damage is gradual. That's why it's more notorious. The person will not know that is having kidney failure until it gets to a very late stage. So we have different causes for both acute and the chronic. Like I mentioned earlier, for the chronic, basically we have those hypertension, diabetes, and some other ones. But for the acute, we can classify them to three. There's what we call pre-renal, the renal causes, and the post-renal causes. When we say pre-renal, that means the problem, the cause is happening before you get to the kidney itself. Maybe from the blood system, somebody lost a lot of his blood volume. You understand? The blood is not able to get to the kidney. The kidney also needs blood flow, adequate blood flow, perfusion, before it can function normally. So when you don't have this, it can cause them to fail. Then you can also have renal causes of the kidney failure. The renal causes, that means the problem is within the kidney itself. Now you can have this when you have maybe some toxins, drugs. You understand? You see some people abuse drugs, all these things, they contain NSAIDs. NSAIDs, when you take them for some time or in certain quantity, they can become toxic to the kidney. Some antibiotics, they can be toxic. And some people will just go somewhere, they will just start giving them these drugs. You understand? So those are renal causes of kidney failure. Then when you have post-renal, that means the problem is coming after the kidney. If you remember the biology, that diagram of the urinary system, you have the ureter coming from the kidney, then going to the bladder. When the urine has been formed in the kidney, it will flow through the ureter, then go into the kidney bladder and be stored before the person will feel the urge to go and pee. So when you now have the problem coming after the kidney level, that's what we call post-renal. And usually you can have obstruction at any level, you understand? For instance, you can have stones inside the ureter.
That's what they call the kidney stones?
Kidney stones. So those stones can lodge inside the ureter, the pipes that connect the kidney to the bladder. So and it can cause obstruction. When there is obstruction, the urine will not be able to flow down. It will build up. There will be backflow. Then there will be kidney failure. Then you can also have in men, or especially elderly men. Every man has a prostate. So you can have prostate enlargement, what we call benign prostatic enlargement. When the prostate is enlarged, the location of the prostate is also alongside with the urinary system. So it can also obstruct the pathway of the flow of the urine. You just see a man waking up in the morning, wants to pee, cannot pee. acute.
Okay, the urge is there to
The
pee,
urge
but
is there. It's
to.
unable to pee because
Okay.
there's obstruction. So that one can be a cause of acute renal failure. So these are some of the causes, and there are also less common causes that can cause kidney failure.
So now, while talking about the causes of kidney failure, you talked about the pre-renal, the renal, and the post-renal. There's something that keeps coming to my mind as we were discussing. You also mentioned like an accident. So let's assume someone has an accident and maybe the windshield just pierces the stomach and goes to the kidney. Does it damage the kidney instantly? Maybe like a cut. Maybe the windshield breaks and it gets into the person's stomach, and then it just goes to the kidney and then just gets a cut. Does it damage the kidney almost instantly?
It can, depending on the extent of the damage. That would be like a traumatic cause now.
Yeah.
The person loses a lot of blood. That would be like pre-renal cause. But when something pierces into the kidney directly, that's like a renal cause.
Okay.
And usually, from like we said, the way God has designed our body system, it would be unusual for that thing to pierce the two kidneys at the same time. It would rather pierce one. And like we said, one kidney will suffice if they are actually in good condition. Will suffice the person.
All right, now having said so much, now let's look at the signs and symptoms. Are there signs that you get to feel for you to know that there's actually something wrong with your kidney?
Yes, there are signs and symptoms of kidney failure. And like we said, these signs and symptoms, they may not manifest on time until the late stages of kidney failure. When we say chronic kidney disease, which is a cause of the kidney failure, it has stages. When somebody gets to the hospital and the doctor is suspecting kidney failure, they will run some tests, maybe we'll get there, and then they will now be able to stage the person, which stage of kidney failure is the person is. So that will also determine this kind of sign and symptoms the person will present with. However, most people will come with, like from the function of the kidney helps to get rid of toxins from the body. When you have the build-up of these toxins, there will be problem. Those are the signs and symptoms that the person will manifest with. So the person with body swelling, the person is waking up in the morning, you see if the face is swollen, unlike when you have heart failure. And the heart too can have its own failure. The body swelling there, you see starting from the legs. But when you see body swelling start from the face, you suspect kidney failure. Then the person may come with anorexia. They just don't want to eat. They don't have appetite. Body weakness, fatigue, generalized fatigue. They may also, in the severe cases, they may come with what we call sign of uremia. Uremia is when you have that toxin has built up to a certain level in the blood, and it will now affect different systems. You may have uremic encephalopathy. When it affects the brain, the person may come comatose, as in unaware of where he is. He's confused, talking confused. Yes. You may also have bleeding diastasis. You see, there's a small cut, but the bleeding will not stop. You understand? They may also come with signs of maybe heart failure, arrhythmia, abnormal pattern of the heartbeat, because that chemical is affecting the heart. They may also have itching, generalized body itching, because when that chemical builds up in the body, tends to cause itching. They may also have the urine. They may present with inability to urinate or diminished urine output. Somebody that's been urinating maybe 3 times in a day before, hardly urinating once, and even when you urinate, just urinate a small amount. These are signs and symptoms that will point to kidney failure.
Okay. So now, having talked about the signs and symptoms, what are the diagnoses for this kidney failure?
When the person comes to the hospital and the doctor, from the signs and symptoms, has taken his history, will now be suspecting kidney failure. Yeah. So we'll subject the person to certain tests to do. And the basic one will start from urinalysis. Urinalysis is, they will just take a sample of the urine and they will insert a strip and test different components on that strip. And what you will have in a kidney that's already failing, you may see blood, traces of blood in the urine, which is not supposed to be. But by the time the kidney is failing, things that are not supposed to appear in the urine, they start appearing. So you see different things in the urinalysis. Then they do what we call kidney function test. They will take, that's from a blood sample. They will take the blood and subject it to some tests. There are different components in that. They will test the urea, they will see the creatinine. These are chemicals that will appear, they will be elevated when you have kidney failure.
Okay.
And then you have the electrolyte as well. You have the sodium, the bicarbonate, you have the potassium. Most of the time you see them, they will be high when you have kidney failure because the kidney is not able to regulate those chemicals, those electrolytes the way it should.
Okay, now you talked about part of the diagnosis. You take your tests, carry out a test, take a sample to the lab. So in a case where the person comes with maybe from the symptoms you've seen, it seems to be a chronic kidney, you suspect it's a chronic kidney problem. Test that goes to the lab, we know that it takes hours, sometimes days to come out. But are there managements that you give to the patients before this lab result comes out?
Of course, there are management options depending on how the patient presents.
Okay.
Some patient will present in a stable condition.
Okay.
They are not in emergency. They won't present as emergency. Some will present as emergency. For instance, a man that presents with urinary retention, cannot urinate, and it has already caused a kidney failure for the man. After taking those samples, in fact, the first thing is for you to relieve that obstruction.
Okay.
The man is in pain, so we need to relieve the obstruction. Pass a tube catheter through his urethra so that the urine can come out.
Okay.
Then we now continue with the other modalities of the test. Or somebody that comes with dehydration, severe dehydration, which will be a cause of acute renal failure, for instance. You need to correct that dehydration. As you are setting the line to give him the IV fluid, you take your sample for those tests. You won't wait for the results. You want to stabilize the patient first. Okay. When the result now comes, it will now guide you towards what other things to do to manage the patient.
So now let's look at who is at risk of coming down with a kidney failure. Is it the children, the adults, men, women, or everybody?
Kidney failure has its own risk factors.
Okay.
And anybody can have a kidney failure. Men, women, children, anybody. It just depends on it will now be the kind of kidney failure they are going to have. Okay. Majorly, when you say chronic kidney failure, you can see in adults. When you say acute, you can see it in children due to causes that are reversible. So some of the risk factors, like you said, include age. As we age, their systems also are becoming weaker. The kidney itself, they are becoming weaker. So a small insult, any small insult can tilt them into failure. Also, apart from age, somebody who has other comorbidities, like I said, hypertension, diabetes. So somebody that has these two is more prone to developing kidney failure. Also, if you have somebody who has been exposed to different toxins, drugs, for somebody that has been abusing drugs like non-steroidal anti-inflammatory drugs, for instance, this thing can build up and cause kidney failure over time. And also, certain categories of people like sickle cell disease patients, people with sickle cell anemia, due to they are also prone to having kidney failure. Also, people that have congenital anomalies, like for instance, some children are born with abnormal kidneys. So this abnormal kidney will not function the way normal kidneys will function. So they're also prone to having a kidney failure.
Now, having said those who are at risk, are there treatment modalities for patients with kidney failures?
Yes, there are treatment modalities, especially if patient present early. And the problem we have, especially in this part of the world, because of different factors, is that majority of patients present late. Okay. People hardly go for annual checkup to check how is the kidney functioning, such that if the kidney has started failing, you get to detect it on time. So, but when patient presents at whatever stage, there are 6 treatment modalities. The first is what we call lifestyle changes. Because of the risk of hypertension in them, and some also having diabetes, you tend to cancel patients on lifestyle changes. In terms of their diet, they need to modify their diet. Somebody with kidney failure will not be able to tolerate a high salt intake. So we'll cancel them on low salt diet. They should not be eating too much salt. And when you, especially in this part of the country, when you tell patients not to eat too much salt, they will tell you, they don't even eat salt. So you have to add that, including Maggi.
Yes.
You see somebody putting 20 cubes of Maggi in their food.
I'm not using salt.
Yes, as I'm not using salt. So in the Maggi too, there's salt there. So we have to mention that to them. And then you have to cancel them on low protein diet too. No protein. When the body breaks down protein, the final breakdown, some of these things that the kidney needs to excrete. So by the time you are eating load of protein, you are increasing the workload for the kidney, which is already failing. So you need to lessen that. So as I said, low protein diet. Also, they need to engage in moderate exercise. Moderate exercise. For instance, I forgot to mention one of the risk factors is obesity. If somebody is obese, you understand, they need to control their weight. To control their weight. So they also need fruit and vegetables. Fruit and vegetables in order to modify their lifestyle. So then, apart from lifestyle, we have medications. They may not be able to reverse the damage that has been done, but they can help to slow the progression of that kidney failure, depending on the stage at which the person is. So if the person is diabetic, for instance, or hypertensive, they need to control those conditions as optimal as possible. You don't play with your drugs if you are diabetic or hypertensive, and then you monitor what you eat as well. So then apart from medications, when the kidney failure has gotten to the last stage where we call end stage renal failure, that is the stage that you just have to do something to replace, to help that function again, either by replacing the kidney, what we call kidney transplants, or by doing dialysis. Dialysis is when you use machine to help the kidney to, do its function, the function of washing out the toxins in the blood. So there are machines that do that in the hospital. And then, like I said, the kidney transplants, the dialysis come before the transplants. When somebody can know, some people, even with dialysis, they can't still perform optimally. So by the time you are doing dialysis for a person, maybe 2 hours in a week, and it's expensive too. So we'll cancel them for kidney transplant if they can afford it. So those are the
kidney transplant
options.
Has now become something else.
Yeah.
All right, now let's look at the preventive measures.
Yes, part of the preventive measures, like I earlier mentioned, is to modify our lifestyle. Okay. If somebody is obese, let him or her engage in exercise and other forms of lifestyle that will that will help to modify the obesity, not just the exercise. Obesity is in terms of what you are taking and what you are expending. By the time you are taking more than what you are expending, then the obesity will keep coming. So apart from the exercise, we ought to also monitor what we eat in terms of calories. So reduce number of calories we eat, eat more fruit, vegetables. You understand? So these are some of the, and then like I mentioned, salt intake. We reduce salt intake. You understand? For somebody who is prone to having a kidney failure, reduce salt intake and protein. Protein diet. Protein should not be too much in the diet. So those are like some of the lifestyle. And like I also said, if somebody is having comorbid conditions that can prone them to having kidney failure, especially hypertension and diabetes, they need to take their drugs as optimal as possible, so that they can control, and that will slow down. Even if they are going to come down with kidney failure, it will take a very long time. Yes.
Okay. Thank you so much, Dr. Isiak, for enlightening us on kidney failure. Now, before we let you go, we'd like you to give our listeners a take-home message, something to keep them in check. Okay.
So on a final note, kidney failure is like I said, notorious, if I can say it that way. because by the time it's setting, it's very difficult to control or to manage. So prevention is better than cure, as they say. So to protect our kidneys, we need to be taking a lot of water. Some people don't like taking water, so we should engage in that. Yes, water intake, especially in the morning before you take anything. You take your water. You don't leave your body to be too dehydrated when you exercise, and especially health check, our annual health check. Let's go for checkup. Whether we are feeling okay or we are not feeling okay, let's go and check our kidneys and other essential organs of our body. This will help a long way to protect us.
All right. Thank you so much, Dr. Abdul Fattah Isiak.
Thank you.
Listeners, we've been talking to Dr. Abdul Fattah Isiak from the Department of Family Medicine, Ahmadu Bello University Teaching Hospital, Sheikh Azara. Dr. Abdul Fattah Isiak is a member of Association of Resident Doctors. He said so much about kidney failures. I hope we've been able to learn from this. And as we always say from here, health is wealth. So you try as much as possible to manage your health before it becomes a problem. All right, listeners, thank you for listening, and join us same time, same station next week for yet another interesting episode of the program Community Health. On behalf of my recording engineer, Yusuf, I am Hasia Ali saying thank you for listening.